I am Dr. Vandana Narula, Senior Consultant Reproductive Medicine, IVF and Infertility Consultant at Motherhood Fertility and IVF Center, Mohali and Chandigarh. In this session, we will be talking about patient assessment and counselling. See, as a patient, when you come to me, you need to tell me the whole of the history. I need the previous history. Generally, when the patient comes to me, we have a host of questions we ask the patient, like age of the patient, then how many years you have been married, what previous treatment you have taken, your menstrual cycle, how is it, the last menstrual period, the semen analysis if it has been previously done, and any other medical history which has been which you are having, or any medication also which you have been taking previously, and also any past history, any family history, any relevant family history. In the first counselling or at the first visit, we see the previous reports of the patient, the previous files which the patient has been carrying, and we take the history. And also, if the patient agrees, we can go for the investigations like a pap smear and transvaginal sonography, and even the blood investigation. See, the counselling starts from the doctor. We have to provide counselling, because when we don't give that compassion, that empathy, or that soft corner when we talk to the patient is like doesn't open up. Patient has to open up. Patient has to tell us the everything, what problems she has been facing, and she develops if she develops that trust, that bonding between the doctor during the course of, like, when we are talking to the patient, that is very important for the further course of action, what treatment we give to the patient, and also for the success of the patient. That is very much important. And see, for counselling, the dedicated counsellors which we have, they will at every step, the patient is not sitting with the doctor. Patient is like moving around in the entire unit, getting tests done, getting ultrasound done, then getting the files signed, and so at every step we have even the nursing sisters and the receptionist and the counsellors. They are providing sort of emotional support to the patient. That is very important especially for infertility patients. See, every patient, every couple who is coming to us is different. So we need to personalize the treatment whenever the patient comes to us. We have different kinds of treatment for different couples. Like, we start from ovulation induction. Ovulation induction we might be offering to patients who are of a younger age and who come to us early, like who have been married who have been just married, or just few years have passed since they have been trying. We start with simpler procedures. And the patients who have been trying for long, or they are of a higher age group, we have to give them a higher edge technology treatment, like natural cycle or ovulation induction might be offered to the younger age group, and then to the age group who has been married for a longer time, or who have patent fallopian tubes, they will be offered IUI. And for patients who have tried IUIs many times, have failed, or they have been married for longer period of time, and other factors which are present for of infertility are present, they might be offered IVF or ICSI, or even donor like gametes. So our evaluation depends on the age of the patient, how many years they have been married for, age of the wife, age of the husband, then the ovarian reserve, the AMH, how many eggs are present in the ovary, the semen analysis report, like how many sperms are their total count, the morphology, the motility. That also is important when we decide upon the course of treatment of the patient. Then whether the fallopian tubes are open or not, and also whether the patient is having any other associated issues like polycystic ovaries, endometriotic cysts, or any septum in the uterus, any fibroids are present, or any other reproductive tract issues which are present. And alongside, we also see the weight of the patient and other issues, any other medical issues which might be present with the couple who is coming to us for the treatment.